Hello and welcome to the Oversharing Mum, where we talk about all things conception, pregnancy, birth, babies. Roman and I have started this channel because we really want to support women on their way to motherhood. And so today I would like to talk to you about some interesting facts about pregnancy. Did you know that your heart actually grows during pregnancy? A woman's blood volume increases by about 50% to accommodate the growth of the fetus. And so this increase in blood flow also puts pressure on the heart, causing it to enlarge and work harder. As a result, a woman's heart may grow up to 20% during pregnancy, allowing it to pump more blood per minute to support the growing fetus. Another interesting fact is that your partner may actually experience pregnancy symptoms. It is common for expectant fathers to experience sympathy pregnancy symptoms alongside their partners, and these can include fatigue, mood swings, and even food cravings. And this is believed to be due to hormonal changes in the body brought about by their partner's pregnancy. So they must be really connected. I think it's a really wonderful thing if a couple is that close. Another interesting thing is that babies cry in the womb, and research has shown that fetuses can produce crying sounds in the womb as early as 25 weeks into pregnancy. Scientists believe that this may be a sign of a baby's developing vocal cords and respiratory system. And actually, really interesting, there's been a lady on Oprah that talks about deciphering babies' cries. So even though sometimes we might think negatively about baby when they cry, when actually it's their way of communicating with us and trying to tell us something. And so I found it fascinating how that lady identified 5 different cries where you would know if a baby was hungry or if a baby was uncomfortable or something was bothering them in some way. Isn't that an amazing language to learn and to be able to conquer? You can actually crave non-food items, and pregnant women are famous for having unusual cravings for things like dirt, chalk, and even ashes. These cravings are called, I think it's called pica, if I'm pronouncing it right. And although the causes are unclear, it is believed to be linked to nutrient deficiencies in the body. And well, this is interesting because Romana is pregnant right now, obviously with her 3rd child. And she told us that she was having strange cravings for chalk. So now, based on this research and these interesting facts that we're discovering, it could point to a nutrient deficiency. We often do discuss diet. Diet is a big topic on our channel anyway. But when we do talk about cravings, it's interesting that we might not be eating as well as we would like to, and certainly during my pregnancy that was the case as well. So a lot of the time I do think it's important to listen to the body, but if we're not experiencing too much of a morning sickness or something towards, you know, having vegetables or something that we know that is nutrient rich sort of foods, then that would certainly be a recommendation to have more of those. And so we will need to be talking to Romana to see what her diet is like and what could be causing these nutrient deficiencies. Did you know that it is actually possible to be pregnant for over a year? I think the longest recorded pregnancy is 12 months and a couple of weeks. So obviously there are different, it's a rare case, and of course there are reasons for that. So maybe a fetus needs longer time to develop. However, I do think it's an important topic in general because I feel like we are not really given the chance for the natural process. Everything is so, well, at the hospital, you know, they give you a due date and then they want for you to give birth at that time. You know, there are so many women that come through hospitals that from their perspective, they're just trying to get you in and out. They're not really thinking about the natural process of, you know, of birth. And so I just feel it's a great shame that we're not giving a chance for the babies to say when they are ready to be born, because that is the natural process. Why are we yanking them out earlier? I just think if there are no complications, of course it has its place. Of course it's important to listen to your doctors. By no means are we saying not to. But at the same time, please do your research. You know, that's why we've started the channel. Let's talk about all these things, because doctors, you know, they want to keep it safe. For them, you know, everybody has their own perspective. It's important, obviously, you know, that they help as many people as possible. And also, you know, they're very busy. But we need to think about ourselves. And if there are no complications, it's always better to go the natural way. It's always better to give the baby the chance. If they need longer time to develop for whatever reason, you know, in nature, when they're done being in the womb, you know, they start knocking. They're saying, I'm ready to be born. And I think it's important to get to that stage rather than be forcing them out earlier. But each baby is different. You know, when babies are born, we keep hearing this information that, you know, each baby is different. Don't be comparing. You know, if somebody starts talking a little bit later, it's normal. It's just how they develop. So why we're not allowing for the same thing in the womb? Why we're not understanding that it could be a month overdue? And I think the doctors would have been saying, you know, let's get you giving birth. Babies, I guess, are different, not just when they're born, just overall, as soon as the process starts. So I think the closer we can get to the natural process, the better for the mother and the baby. Did you know that pregnant women suffering from heartburn are more likely to give birth to babies with full heads of hair? A study has shown this fact. This is really interesting because actually what causes it is what they believe from the study is that this is due to increased levels of hormones in the body. And they actually cause this heartburn and also stimulate hair growth in the fetus. And another interesting thing is that babies can be born with teeth. It's actually quite a rare thing. It's only 1 in about 2,000 babies born with teeth, but babies can be born with fully formed and fully erupted teeth. This is called natal teeth. And it's nothing to worry about if it's not causing any issues with feeding, but they may need to be removed. So this is just something to keep an eye on. If everything is fine, the baby is you know, feeding okay, and they're not a choking hazard, then everything is fine. It's just one of those things that occurs. However, they might need to be removed. So this is just something to keep an eye on. So these were the 7 interesting facts about pregnancy. We hope you've enjoyed it. Please like, subscribe and share the content. And let us know what other topics you would like for us to cover. So thank you very much for watching. Bye.